Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha Abalada, and my co-host today is Gazanya McCoy, Health Navigator and Diabetes Peer Educator at Roots Community Health Center. We are reporting for the week of October 5th, 2020. As health professionals rooted in Oakland, serving some of the people most vulnerable to getting and suffering from COVID-19, we are here to cut through the noise to give you the information you can use to keep yourself, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking in 15 minutes every Tuesday morning. Please submit your questions in the comments, by direct message, or by email to admin@rootsclinic.org. Now, we know that even though the pandemic is worldwide, the effects are different depending on where you are. So we are here to give you up-to-date information about Oakland and East Oakland in particular. The numbers in Alameda County keep climbing, though not quite as quickly as before. We now have over 21,000 cases and 425 deaths in Alameda County. Oakland is about 25% of Alameda County's overall population, yet has 40% of the county's COVID cases. Case rates and positivity rates continue to be most concentrated in East Oakland. And as we've seen week after week, those darkest blue zip codes in the 94601, 94621, and 94603 have case rates that are more than triple the county average. And here you see positivity rates in those same three zip codes, which are at 13 to 15% positivity, while the county average is just 4.4%. So the bottom line is the virus is hitting Oakland harder than most parts of Alameda County, and it's hitting East Oakland even harder. This is our reality. And one of the things we worry about with this reality is that we know that the rate of diabetes and other conditions that make you at risk for poor outcomes with COVID are also happening in higher concentrations here in East Oakland. Take a look at this map, which shows the rates of diabetes hospitalizations, and this map, which shows the rates of diabetes mortality. As you can see, our same East Oakland zip codes are lighting up, and this map looks very similar to the COVID maps. Having type 2 diabetes increases your risk of severe illness from COVID-19. We are less certain about type 1 or gestational diabetes, but we are certain that especially if you don't have your blood sugar under control, COVID-19 is much more dangerous for people with type 2 diabetes. Now, why is that? I don't think we can pretend to know all the ways or all the reasons why people with diabetes do poorly with COVID-19 in particular. COVID-19 is still new to us, and it is unusual in terms of how many of our organs and bodily systems it seems to be able to impact. But we do know some things about type 2 diabetes in general, and we have learned a lot so far in this COVID pandemic. First, if you have diabetes, your body has a hard time controlling your blood sugar, so you may need the help of pills or even insulin to help keep it under control. Now, high blood sugar in itself interferes with our immune response. So we know that those who have poorly controlled diabetes in particular are susceptible to all kinds of infections, from skin infections to pneumonia, by all kinds of organisms from staph to tuberculosis to influenza. COVID is no exception. Speaking of the flu, I'll take a moment here to speak on the flu vaccine. If you have diabetes, you know that it is recommended that you get the flu vaccine every year. But this year, it's especially important. Get the flu vaccine. No, it's not a perfect vaccine, and yes, it can sometimes make you feel a little under the weather after you get it, but it can save your life. People with diabetes, even well-controlled diabetes, are at high risk of serious complications of the flu, including pneumonia, bronchitis, sinus infections, and more. According to the CDC, in recent seasons, about 1/3 of adults hospitalized with the flu have had diabetes. The flu makes your diabetes worse, and diabetes will make the flu worse. And if you get COVID and the flu at the same time, it could get particularly dangerous for you. The best protection from getting the flu is to get the flu vaccine. We are hoping that all of the masking and distancing we are doing for COVID will make for a lighter flu season, but this remains to be seen. So please get the flu vaccine, and note that people with diabetes should get the injection and not the nasal spray vaccine. Another problem that people with diabetes face that does not help when it comes to COVID is inflammation. Especially if you add obesity, which is often present with diabetes, you get a state of increased inflammation, which is not a good combination with COVID-19. COVID can set off a very powerful inflammatory response in the body, which can affect the vessels and organs, some of the same body parts and systems that are affected by diabetes itself. The inflammation associated with COVID-19 is a main culprit in severe consequences of COVID, and these appear to be worse in those with diabetes, especially poorly controlled diabetes. So the best things you can do are, first, don't get COVID. You are at high risk and should avoid being exposed to or contracting COVID, period. And remember, the older you are, the more these precautions apply. Your risk is greater if you are over 50, even greater if you're over 60, over 70, and so on. But type 2 diabetes, especially when it's poorly controlled, puts you at risk for serious illness from COVID at any age. If you're unsure of someone else's exposure, don't spend time indoors with them. Those within 15 feet of one another should all wear masks. Second, if you have diabetes, control your blood sugar. Third, get the flu vaccine. It could save your life. If someone you know, someone you care about has diabetes, please pass this information on to them and make sure they know the importance of not exposing themselves to COVID, of keeping their blood sugar under control, and of getting the flu vaccine this year more than ever. And now my co-host Gazanya McCoy, navigator and diabetes peer navigator, will go into more detail about diabetes, especially in the time of COVID.
Good morning, everyone. I'm Gazanya McCoy, health navigator and diabetes peer navigator. Having diabetes during the COVID-19 pandemic can be very distressing. You are considered high risk. Roots Community Health Center is here to empower people who have diabetes, especially during COVID-19. I would like to share 5 self-care behaviors for managing your diabetes. Number 1, monitor glucose. It is important to know your glucose numbers. You need to know if your blood sugar is too high or too low. Regular blood sugar monitoring is the most important thing you can do to manage diabetes. You'll be able to see what makes your numbers go up or down. By identifying and recording changes in your blood sugar levels, you'll have more information about how food, exercise, stress, and other factors affect your diabetes. Number 2, take your medication. Taking medication helps reduce your risk for complications and help you to feel better. Your healthcare provider helps by choosing the right medications for you, but you play the most important role. Make sure you understand your medication plan so you can take your medication in the right way at the right time every day. Be sure to fill your prescription before you run out. Number 3, eat healthy. Having diabetes doesn't mean you have to give up your favorite foods. In fact, there is nothing you can't eat, but you need to know that foods you eat affect your blood sugar. A healthy meal includes a moderation of carbohydrates and fruits, plenty of veggies, protein, dairy, and healthy fats and oils. Number 4, exercise. Being active is not just about losing weight. It has many health benefits, like improving blood pressure, lowering stress and anxiety, and improving your mood. Physical activity can also help keep your blood sugar levels normal and help you keep your diabetes in control. Being active includes all the ways you move your body and decrease the time you spend sitting. It is recommended that you exercise 150 minutes per week. That's 30 minutes a day during the week. This could be listening to your favorite song and dancing while doing chores around the house, or sitting in a chair doing different stretches and light movements. Be sure to consult your doctor before starting any exercise routine. And number 5, have a positive mindset. Diabetes can affect you physically and emotionally. It's natural to have mixed feelings about your diabetes management and experience highs and lows. The important thing is to recognize these emotions are normal and take steps to reduce the negative impact that can have on your self-care. Healthy coping means having a positive attitude towards managing your condition. It's the first step on the road to reaching your health goals. Try to focus on positive thoughts. There are 2 proverbs that I would like to share. 1, a calm heart gives life to the body. And 2, a joyful heart is good medicine. It may sound too simple, but having a positive attitude really helps. Here are 3 resources that can help you in managing your diabetes. First, if you are in need of healthy food like veggies and fruit, Roots has produce boxes that are available to prepare for your family meals on the 1st and 3rd Tuesdays a month at 7272 MacArthur Boulevard Health Center, and 2nd and 4th Thursdays at our Sobrani Park lot at 105th and Eads from 11 a.m. to 1 p.m. at both locations. Second, walking can be a powerful medicine for your body and mental health. Join a Coma walking group Sundays at 8:30 a.m. at 6955 Foothill Boulevard, Oakland at the Coma Outdoor Market. And third, education and support is very important. Since COVID-19, we now offer our free diabetes class virtually. You can call in with your phone or log in with a video conference. It takes place every 2nd and 3rd Thursday of each month. Navigator Jackie Andrews and I teach the classes, and you will get follow-ups with nurse practitioner Kiona Boykin. In these classes, you will learn how to control your blood sugar and enjoy your favorite foods at the same time, what to do when your blood sugar is too high or too low, how to manage stress related to diabetes, how to talk to your doctor about diabetes, and you will get engagement and support of others who have diabetes also. While supplies last, we give up to $200 in gift cards to participants who are Roots patients that have diabetes or prediabetes that complete all 5 classes. Please call 510-777-1177 to sign up. In conclusion, having type 2 diabetes does increase your risk of severe illness from COVID-19. So do all that you can to prevent yourself from getting it. And do all you can to keep your diabetes under control. Remember, monitor your glucose, take your medication, eat nutritiously, exercise, and maintain a positive mindset. And if you need resources to help you manage your diabetes, Roots can help with free healthy food, diabetes classes, walking groups, and more. And now, back to Dr. Noha for some final words.
Thanks for that, Gazanya. Now here's our best advice one more time. Continue taking your diabetes pills and or insulin as usual, as prescribed by your healthcare provider. Make sure you have at least a 30-day supply of your diabetes medications, including insulin. Test your blood sugar and keep track of the results as directed by your healthcare provider. If you have concerns about your condition, if your sugar is out of control, or if you're not feeling well, contact your healthcare provider. If you don't have a healthcare provider, get one. If you have diabetes, you need a primary care provider. Please get one. Reconnect with your provider if you're not in touch. If you don't have a provider, please reach out to the number of community health centers, including Roots Community Health Center, to make sure that your diabetes is being managed. It is important more now than ever. And get the flu vaccine. That concludes today's health briefing. Please submit your questions in the comments, direct message us, or send us an email at admin@rootsclinic.org, and we will address them in upcoming briefings. Please tune in next Tuesday at 10 a.m. Thank you for watching.